Ladies and gentlemen, once again, welcome to the second annual Exotic Research Conference and our insightful workshops. Tardy, but here. Our last speaker this evening, Dr. Waling, is a graduate of Bastyr University in naturopathic medicine. He's a nutrition specialist and has a company that manufactures such products. He's an international consultant in these fields, and this evening is going to be addressing the crucial aspects and treatment that he has created for various aspects of heart disease, the #1 killer in this country and others around the world. And with that, please welcome Dr. Ron Waling.
Thank you. Not like you don't already know me, huh? Anyway, we're going to be talking about the heart in the beginning of this lecture. What I usually do and I excel at the most, I have been in clinical practice for 17 years, and I've handled a myriad of chronic degenerative disorders. So what I like to do is open the floor when I get through this presentation so that you can ask questions about whatever, and maybe I can come up with some answers or give you some feedback on whatever that condition might be. We won't just limit it to the heart. But we'll start with the heart, and I'll try to give you a fairly good understanding. There's so much to know about the cardiovascular system, and you're going to find out, though, that the real cause of all of this is not as broad as what the media and the medical community would like you to believe. So I heard that. Yeah, waited 20 minutes for the tear. That was great. I love it. Anyway, thank you. I've been to Phoenix several times. I've actually treated some patients here, but it always seems to have been in the spring and in the fall or winter time. I've never really experienced midsummer in Phoenix, and it's quite interesting to know that when you turn the shower on, the cold water is just as hot as the hot water. And I decided that I'm going to find a new side business. I'm going to go into the deodorant soap business now because I think it'd be a good business here in Phoenix. Anyway, I have here, how do we put this on, Larry? Oh, I do. Okay. Okay, let me see. I've got to find my area. Okay, I can right to there, okay? Yeah, you want to go over? Then I can go right to there. See, I'm Italian, and one thing you can't do, if you want to drive an Italian crazy, make him stand still while he's talking. Can't handle it. Make him wait for a sheet of paper. That's right, a sheet of paper with his name on it. So, as soon as we get, there's a picture of the heart. We've all seen it before. Normally what you would see on a real heart in certain areas, like right in here, you'd see little deposits of fat because, of course, the heart does have a little bit of fat in it. Just like meat in the store, you see what they call marbling. You see those little lines and streaks of fat. The heart has that too, but it's pretty much pure muscle. So when we start getting a fatty buildup on the heart, that, of course, starts creating some problems, because without the heart, we don't survive and thrive very well. The main function of the heart is to push the red blood cells all around the body. They go from the heart to the lungs, back to the heart, up to the head, down to the feet. They take one good look at those feet and come right back up to the heart again. So anyway, that's the heart. And the heart has, as you can see, some major arteries and veins coming into it. And the parts that usually cause problems for us is when we get buildups or narrowing of the arteries, the coronary arteries. We have two of them, the left and the right coronary artery. And then those have, of course, various branches. And then they break down into smaller areas. You have arteries, veins, arterioles, venules, and then we have capillaries. So it goes larger to smaller little areas. Now those capillaries, of course, are the farthest branches, and they're very tiny, and the red blood cells actually have to kind of line up to get through there. Now the problem with that is that if we eat a high fatty diet, the flow of those red blood cells actually slows down. Normally the red blood cells, the pattern is pretty scattered as it's going through the arteries and veins. But as we eat a high fatty meal, they start to stack up because they get sticky. And we'll be talking about that. Now, one thing that I want to talk about as well is blood vessel anatomy, okay? The blood vessels contain basically 6 layers. You have what they call the tunica adventitia, which is the outer layer of the, I had a transparency for that, but unfortunately it didn't make it into my pile. So I'm going to wing it. So think of 6 layers. The outermost layer, tunica adventitia. Then you have a layer of elastic tissue around that. Then what they call a tunica media. These are muscle layers, okay? Tunica media, tunica adventitia. Then we have another elastic layer around the tunica media. Then you have, on the innermost part, you have the outer layer of the tunica intima. And then, of course, the part that is the inside of the blood vessel is the inner layer of the tunica intima. Now, when we get a problem with our vessels, the tunica, the outer layer and inner layer of the tunica intima are the parts that get affected the most. Now, what I'm going to do is give you a little definition, or Larry, we're going to define certain terms because we always hear about atherosclerosis, arteriosclerosis. Oh, it's up. Okay, but you can't read it. Nor can I. Okay. Anyway, arteriosclerosis basically is a hardening of the arteries themselves. Okay. There's a difference because we have what we call atherosclerosis. Atherosclerosis is a buildup of a soft, fatty layer in the arteries and veins. Okay, so there's a difference there. Then we have myocardial infarction. Of course, everybody knows what that is. It's a heart attack. We have reperfusion. That's when you have a blood vessel or artery or vein that's been choked off by a plaque or a spasm, and you find a way to get the circulation flowing through that area again. So that's reperfusion. Then we have ischemia. Ischemia is when you get a narrowing or a blockage and you get a decrease of blood supply. And that's where you start getting tissue damage to the heart. Because if one of those major arteries gets cut off from blood supply, you start getting into what we call hypoxia, which I think is the last, no, it's not on there. Anyway, hypoxia means that you have a decrease of oxygen to the area. And when that happens, of course, the tissue dies because that's what keeps us alive is oxygen. Then we have arrhythmia. Arrhythmia is where we have abnormal beat to the heart. Okay? So now we've defined those terms. So I can go on and feel comfortable in that. Now, what's going on here? Okay. Now, the thing that we always hear about with coronary heart disease is we keep hearing about cholesterol. Well, we have fat in our body. Fats are necessary. Cholesterol itself, in and of itself, is not bad for us. We need cholesterol because cholesterol is necessary for cellular health, believe it or not. It's also very necessary for producing hormones in the body. We make our steroidal hormones, estrogen, progesterone, DHEA, cortisone, cortisol, you know, all those come from cholesterol, so they're very necessary. And the part that we get those from is primarily those LDLs, low-density lipoproteins. Those are the ones that they keep saying cause the hardening of the arteries, because we keep talking about, oh, they've got high LDLs and low HDLs, which is high-density lipoproteins. The difference being is that the low-density lipoproteins are responsible for carrying things into the cell lining, cell wall. The high-density lipoproteins are responsible for taking those cholesterols out of the cells and bringing them back to the liver, which is another important point. You know, a lot of times when a person has a high cholesterol level, they go to the doctor and the doctor says, oh, we got to get that down. You got to go on a cholesterol restrictive diet. Well, the interesting thing about that, roughly 20% of the cholesterol in our body actually comes from what we eat. Only 20%. 80% is actually produced in the liver. So when we have a cholesterol imbalance, unless you are a person that eats a lot of fat, sausage, things like that, you have more of a liver imbalance than you do a dietary problem. Although your diet is very important in solving the problem of heart disease and arteriosclerosis. Now I'm going to give you, okay, we talked about the LDLs and HDLs. Now we have two types of fats in our system, saturated fats and unsaturated fats. The saturated fats are cholesterol, and these cholesterols, what make them different from unsaturated is that they do not have what they call a carbon-carbon double bond in them, okay? There's nothing there for anything else to attach to. The unsaturates, which are your polyunsaturates and your monounsaturates like, you know, canola oil, olive oil, those have a double carbon-carbon bond, okay? That means that they can go around and pick things up to mop it away. So that's what's real important about that. Now, there's we talked about, you know, cholesterol and its need in the body, its purpose. Now, along with that, there's what we call very low density lipoproteins, VLDLs. These VLDLs are called chylomicrons. Chylomicrons actually translate, it's Greek, and it translates to small fat globule. That's basically what it means, small fat globule. And what those chylomicrons do is that those attach to the cholesterol and then carry it out, okay? Now, along with this, they're finding that there are some proteins that are involved also with hardening of the arteries. You know, we always tend to think that it's calcium and fat, but why did it get there in the first place? Well, part of that is that we have these proteins, which we call ApoA and ApoB protein. There's other ones as well, but these are the two main ones that we're looking at right now because we found that the ApoB protein is responsible for hooking up to a cholesterol and carrying it into the cell and making it stick. These proteins are responsible for the adhesive ability of cholesterol. Then we have the ApoA. ApoA also helps with that stickiness, but actually it helps to take it again out of the cell. So when we're doing tests, now the testing for hardening, or for, let's say, coronary artery disease, we're finding better ways of giving a predetermination as to whether you're at risk of getting a heart attack or having the process of arteriosclerosis going on through a blood test without having to do angiograms, things like that. Now, we have also, with the low-density lipoproteins, we have apolipoproteins. Now, these are the things that really cause the problem because of their stickiness, like I say, because of the protein, apoproteins. So anyway, how do I get this on, Larry? Switch. There we go. So anyway, there you go. You have low-density lipoprotein with, which is the fat globule, with the ApoA protein, and it creates the lipoprotein A. So that's what that looks like. Now, we talked about, again, one other thing that I didn't talk about, another type of fat is called triglycerides. Triglycerides are important because they are a source of energy for us. Our body needs triglycerides to produce energy. It's also a form of stored energy. Okay, well, I was hoping this would be a little clearer for everybody to see. Basically, what it's saying is that we eat some food. Foods get converted into glucose. Glucose gets converted into triglyceride, or the fats of triglycerides are right there. They get picked up by the chylomicrons, okay? Then the chylomicrons carry the triglycerides directly to the tissue, or they're carried into the liver, okay? Now, normally what happens is you got the HDL. If you have enough HDL cholesterols, those chylomicrons, those very low density lipoproteins, aren't going to cause any problem because the HDLs are going to pick it up and bring it back into the liver again. It just keeps getting recycled. It's not really sticky. Okay, so the problem lies in the fact that when we have a lot of fat, we're consuming more fat, or our body's producing more cholesterol in the low form than what we have in the high density form, and it starts beating out the high density lipoprotein, and we start getting fat buildup in the system, okay? And that's what we are right here. Okay, so we have cholesterol triglyceride coming out to the tissues. Now, some of that fat is used for energy, like I said, or for cellular metabolism, for hormones, whatever. But the stuff that is not, all of a sudden starts building up. Now, we're going to get into, like I say, there is another problem with this, because this is my philosophy about heart disease, is that it all boils down to inflammatory process. And we're going to cover that in a little bit. But we're going to talk about, well, here we go. Let me show you this right here. This is atherosclerosis. Can we zoom in? Can you kind of read that? Okay. This is showing a buildup of plaque. Okay. You see that little fibrous, you got the fibrous cap right here, and then you get the fatty plaque buildup right here. And remember we talked about the tunica intima? That's right in there. And that's where that's all building up. Now if you look down, oh, you can't see it over here. Okay. Now if you look over here, this is showing a narrowed artery. And that narrowed artery is a result of those plaque buildups, and it makes it look like it's spasmed or constricted because the tissues contract around it. Okay, now I'm going to show you, now there's two types of plaques in the body. One is a lipid core, which is soft, and we'll see that here. And a lot of times that gets built up. Oh, let's zoom out a little bit. Okay, so what you see here is a soft plaque forming right here. Okay, and then you get that little fatty liquid in the center. Now this never gets hard. The only reason it doesn't harden is there's not enough irritation or inflammation for the calcium to deposit there, so it stays soft and liquid. What happens is like a cyst, okay? We've all had a little cyst or like a zit, you know, that you get that pus there. And so you can kind of liken it to that if you want, okay? It starts expanding, then what happens, it gets to the point that the tissue cannot hold it any longer, and it ruptures. And then what happens, as that liquid gets into the system, it becomes very sticky again, like glue, okay? That in turn makes a clot, and that is how we can get an embolus. Emboli are blood clots that have broken loose in the body that create strokes, heart attacks, what have you. So that's what you see with the soft lipid core plaques. Now these types of plaques are more responsible for killing people than the ones with the calcium in them, because they just kind of go like an eruption of an earthquake. You never know, and it just happens. No warning. Okay, now here's one where you get basically a calcification as a result of irritation. And then you get, okay, so you see, can we see all this? Let me see. Right there. Okay, normal artery, get a plaque forming. Now the plaque gets bigger, artery enlarges, calcification occurs. Now what happens when you get calcification? It gets hard, right? Doesn't expand, doesn't contract. Okay, it keeps expanding. The flow gets, you know, harder and harder. You get more buildup of pressure, and then all of a sudden the red blood cells, it's kind of like a buildup of minerals in a pipe or sludge in a pipe, it starts accumulating, just slowly builds and builds and builds, till all of a sudden there's nothing for the fluid to pass through anymore. And that's what happens. All of a sudden, the blood cells just start backing up and creates another blockage. Hence, stroke, heart attack. I was hoping this would come out a little clearer because I scanned this. This is what it looks like. These are actual arteries, believe it or not. This, of course, is a normal, healthy one. You can see there's nothing in the lining there. Now here you see a buildup of the plaque right there, that little white streaking stuff, okay? And you can see bulging occurring a little bit in the artery. Then you get severe bulging and ballooning of the wall here as a result of the plaque building up in that muscle layer of the cell. Now we know that there are specific areas that these plaques build up in the body more than in others. Okay, so this one is kind of an indication of where you find them. And usually it's at what we call the bifurcation. The bifurcation is where the artery branches off, it splits, and it's usually at those points because the plaque's going to build up at its weakest point. That's the weakest point. So you see it up here where the common carotid branches off into the brain. We see it here in the innominates and in the aortas. Then we see what we call common iliac, which is down here. And we'll talk a little bit about that in a second. And then in the popliteal, which is back here. And how many times have you heard people say, oh man, I tried to walk upstairs or something and they get pain, spasm. A lot of times it's because they have a blockage. They got plaque there. And therefore it's creating that problem. Okay, now here's the statistics on heart disease. And it's pretty shocking. Let's see if we can zoom in on this. We'll do it this way. And we'll slide it up. Okay. This is cardiovascular disease in America. 58.8 million Americans have one or more types of coronary vascular disease. 1 in 5 Americans has some form of it. 1 in 3 men can expect to develop some major coronary vascular disease before the age of 60. The odds for women are 1 in 10. Now, we're going to talk a little bit about women as well, why they have an increased risk. Oh, we have a pointer. Okay, there it is. Couldn't find the button. Okay. Okay, let's move this up. Okay, more than 2,600 Americans die every day of coronary vascular disease. An average of 1 death every 33 seconds. It's pretty amazing when you stop to think about it. It's a lot of people. From 1986 to 1996, death rates from coronary vascular disease declined 21.3%. In the same, let me see, where are we? Yeah, in the same 10-year period, the actual number of coronary vascular deaths declined only 2%. So we're decreasing the rate, which people are getting it, but people are still dying in high numbers of the disease. Okay, and then, now here's the big one. It is a very lucrative economic business, the business of coronary vascular disease. And right here, the cost of cardiovascular disease and stroke in the United States in 1999 is estimated at $286.5 billion. This figure included health expenditures, direct costs, which include the costs of physicians and other professionals, hospitals, nursing home services, the cost of medications, some home health, and other medical disabilities, durables, And boy, I can't read that. Lost productivity resulting from monthly, and anybody read that? Mortality and direct costs. Okay. I guess it's the angle. Oh, much better. So anyway, you can see that it's a very large business. Very large business. And actually, you know, when you think about it, that's roughly 1 million people a year die from coronary vascular disorder. And that doesn't necessarily mean just in the heart. It could be in other locations of the body. Okay, now the development of atherosclerosis, arteriosclerosis, like we talked about. The main causes are injury, infection, tumor formations, hardening of the arteries, of course. Now this all boils down to what I said earlier. I believe it's just an inflammatory process which is the main cause. Because when you hurt yourself, you get inflammation. I also believe this is how cancer starts. But see, the thing that leads up to this, one thing I didn't cover yet, is that our body is constantly producing toxins for itself. So this is always a process of the body having to clean itself. Okay, we're producing toxins, we're taking those toxins out of the body. What happens is we get to polluting our body so much with bad diet, not enough sleep, too much emotional stress, and all of a sudden we start getting a buildup. That starts affecting all of this. That means we don't heal as well. You notice sometimes you cut yourself and it'll heal within a couple, 3 days, and at other times if you're really stressed, you cut yourself and it'll take 2 or 3 weeks and you're going, man, I can't believe it's taking so long. Why? Because your nutritional base isn't there, because you're toxic in your body, because you're under stress, which means when you're under stress, your hormones come into play as well. You get an elevation of cortisol. Cortisol suppresses immunity, it suppresses the healing process. Cortisol is there to help decrease inflammation, but at the same time, that cortisol is doing some bad things as well as some good things for the body. That's why, you know, we start talking about taking DHEA, things like that, to offset some of these adverse effects from stress in our body. Okay, now, what we're doing now to find all these things out is, you know, testing the blood for these different things. The blood chemistry abnormalities that we look for the most now are high levels of one type of cholesterol, which is your LDLs, which we consider the bad cholesterols, which I said is not really a bad cholesterol. It's just that we're not getting enough HDLs to carry it out, or we're producing too much of this apolipoprotein A. That's causing the problem. And we're finding that that is actually the higher risk factor. The apolipoproteins, A and B, actually B more than A, is creating this arteriosclerotic process. Okay, we have low levels of the HDL cholesterols, high levels of triglycerides, and then we've got amino acids that come into play. We're looking at now homocysteine. Homocysteine is a metabolic byproduct of methionine. Methionine is a detoxifying amino acid in our body, and it gets converted into homocysteine, which then gets converted into cystothionine. And what happens is we get a blockage in our metabolic process where we're not converting homocysteine into cystothionine, and then we get a buildup. Now, we know that people that get a buildup of homocysteine have a much greater risk of having a heart attack. In fact, they can predict, depending on the level of homocysteine in the blood, that you're maybe a month away of having a heart attack or whatever. So that's one of the monitors that we use when we're checking people out for, you know, their risk of heart attack. Now, other factors that come into play, diabetes is something that causes arteriosclerotic plaques. The reason being is that insulin, you know, diabetics have to take shots of insulin. That insulin, the purpose of that is to get sugars out of the blood and into the tissues for storage. Preferably, we'd like to get our sugars converted into what we call glycogen, which gets stored in muscle. But more times than not, it gets converted into triglycerides. these triglycerides go into plaques. And therefore, diabetics have a higher incidence of heart disease and artery disease because of this, okay? Lack of exercise, obesity. We have a lot of couch potatoes today. One of the things that people have to do is get out, start exercising, doing more. You know, people are working on computers now. We don't do the things that we do like when I remember as a kid. You know, we had 3 television stations back then, and, you know, there wasn't a whole lot on that was good. So we were out playing, doing things. Like today, right? Unless you're into action movies. So, but anyway, you know, people need to get out and do more things. Okay, poor diet. We talked about autointoxication already. That's a major cause of having heart disease. And not just heart disease, cancer and other degenerative processes as well. Because we know when we start cleansing the body, these things will clear up. And that's the difference between actually holistic medicine versus conventional medicine as it's practiced. Holistic practitioners, I hope, will try to get to the cause. They try to detoxify the body. They try to make lifestyle modifications. With those lifestyle modifications, you can make reversals in any degenerative process. I've helped people that were terminally ill with cancer that reverse their cancers through lifestyle modification. Unfortunately, it doesn't work for everybody, but for those people that have benefited, it was great. It gave them a better quality of life. We have hypothyroidism. That's one thing that you're going to find that a lot of people are walking around with what I call subclinical hypothyroidism. That's where you feel a little cold, you're tired a lot, but you know, you go to the doctor, he draws your blood, and your thyroid hormones are normal. Well, there's a syndrome going around that's called Wilson syndrome. And Wilson syndrome is just that. It's a hypothyroid condition. And what thyroid hormone does is it helps to metabolize those fats. It also, interestingly enough, higher levels of thyroid help to strengthen the contractility of the heart, but it actually relaxes the peripheral circulation. That means the blood vessels farther out from the heart relax, so it actually lowers blood pressure. So you can have a person that's got a low thyroid function that has high blood pressure because of the low thyroid. And you've got these doctors out there trying to just give them antihypertensive medications, right? So they give them diuretics, they give them beta blockers, they give them calcium channel blockers, but they don't look at the cause being the thyroid. There's studies coming out on this now. They've been out there, but doctors, unfortunately, you know, a lot of times they get so busy, they don't take the time to look. Or a lot of times, they just don't take the time to listen to the patient, because if you really listen to your patient, you're going to see they're telling you what the problem is. They are telling you. If you just listen, and you can come up with some conclusions and some better answers for them. The other thing, women. Estrogen deficiency. You're seeing women with hysterectomies today. And I'm not a proponent of hysterectomies. I believe you can reverse fibroid tumors doing various therapies, magnetics, herbals, you know. Some don't respond very well, but there are doctors out there that are very expert now, surgeons, that will leave the uterus intact, because I believe the uterus was there for a reason. Don't take it out. If you can take out the fibroid without affecting the rest of the area, then just take the fibroid out, leave the uterus and the ovaries intact. But you see, doctors don't do that. It's easier for them to just go in and yank everything out. It's just like I had a patient from Canada. She had some fibroids. We worked on her. She was responding, but not well enough, so we opted for the surgery. She went and had the surgery. I requested, do not touch the ovaries. There's nothing wrong with the ovaries. Don't touch them. Surgeons went in. I didn't show up for the surgery that day, and they yanked everything out. Everything. Now what happens is this person starts suffering from emotional imbalances because estrogens and progesterone start dropping out, you know, and it affects everything. The adrenal glands have to try to make up for that deficit. They can't. So now this person is at a higher risk of arteriosclerosis because the estrogens help keep the fatty plaques out of the arteries. And also, estrogens are responsible for decreasing the risk of osteoporosis. We have progesterone, which helps with anxiety attacks, you know, because a lot of times you start putting a person on estrogen, they start getting anxiety attacks. You need to supplement them also with progesterone because that balances all that out. So you can see how you can create a vicious cycle here with all this. Now we talked about the diagnoses of different areas of, you know, a person with coronary artery disease or arterial disease in general. Okay, so we'll start with the legs. We have what we call intermittent claudication. Intermittent claudication is where they get aching in the legs or calves as a result of some exertion. And there's 3 stages of that. We have a mild cases, moderate cases, and severe cases. And then, well, there's 4 very severe cases. So with the mild cases, the pain occurs after walking, let's say, several blocks or several flights of stairs very rapidly over exertion, and all of a sudden you start getting some cramping, and you notice that it comes on a regular basis. Then you can start thinking, oh, I might start having something going on with my circulation here. So that's what we have to look at with that. Now with a mild case or moderate case of intermittent claudication, the pain occurs after walking 2 to 3 blocks or just going up and down a couple flights of stairs once or twice. Then you start noticing the same thing. Now with severe, the cramps occur in very short distances, maybe a quarter of a block. And believe me, I have people that are much worse. I have some people in the critical stages. One gentleman is so clogged that he can barely go up 2 or, you know, maybe half a dozen stairs. Not flights, just stairs, without his legs wanting to give out from pain and spasm. He just doesn't have, there's no power there. The test for that, the only way to really tell how bad that is through arteriograms. You can do Doppler ultrasound. Hopefully it'll pick it up. But that's how we diagnose those if you want to see a visual picture. I'm real keen on Doppler ultrasound if you can do it because it's non-invasive. Arteriograms I don't like. They're shooting dyes in there, you know, trying to look in your vessels. You actually have a risk of throwing an emboli, having a stroke. So not a good idea if you can avoid arteriograms. Then we got kidney blockages. What happens there? You get a narrowing of the arteries in the kidneys, and then all of a sudden you start getting hypertension. Okay? So again, what happens? The doctor starts giving you diuretics, you know, calcium channel blockers, beta blockers, what have you, statin drugs. Now the problem is giving the diuretics stresses the kidneys out more. So what are you doing? You're killing them. You're killing them. The best thing to do is start dietary modification, getting them on good nutritional supplements, things like that. You got to clean it out. Also, we didn't mention this, but chelation therapy, and we'll talk about that in a little bit. Okay, now we've got the brain, okay? The brain, as we showed in that other photo earlier, supplied by the 2 branches of the carotids, okay? What do we get there? You get strokes, basically. Start hearing buzzing in your head. You know, a lot of times you hear people say, well, I hear this buzzing. And a lot of times it's not in the ear. The buzzing's in the back of their head. Or they'll feel something, you know, like something crawling through their head. And that's because that's restricted venous flow. And what it happens is it creates turbulence. And that turbulence, in turn, makes you feel it. It creates vibration. So you're feeling it. And if it's bad enough, you hear it. And it drives people crazy. And so they'll go to their doctor and they go to the otolaryngologist and they're looking in their ear and they're saying, there's nothing wrong in there. We don't see anything. But they don't stop to think this could be arteriosclerosis. And they never go to get the proper diagnosis. Then these people end up getting mini strokes or major ones in that case. Now, the way to, in fact, you know, 50% of all strokes are caused by these atherosclerosis process in the carotids. Okay, the other way doctors diagnose these is they listen with their stethoscope and you hear what they call murmurs and thrills. Okay, that thrill is that vibration. That's what they hear is the vibration. And the murmur is that turbulence that they'll hear. We get what we call transient ischemic attacks. That's where all of a sudden you just kind of like, you get dizzy for a second. You're standing there and all of a sudden you blank out. And then you come back. Those are transient ischemic attacks. That means you're just for a brief moment getting a blockage of the circulation to the brain. And so it causes that little lapse. So then we can do, again, Doppler ultrasound, which is a good one. We do that right on the carotids over here. And then again, arteriograms. Then last, we get the heart, okay? A lot of times, people don't know they're having heart attacks, and they are. Sometimes they just feel tired, and they just don't feel right. You know, we're always taught that you have the classic symptoms: sweating, nausea, pain shooting down the left arm. That's not necessarily the case. It doesn't always happen. Sometimes you're just tired. You just don't have that energy, and you don't know why. Classic example, I have a person that we sent in for a treadmill test, and they had signs of a prior heart attack that we figured was roughly 2 years old. And this person never had any of the classic symptoms of a heart attack. They just had fatigue. We almost thought this person was having a congestive heart failure as well, but they weren't. But this person, I believe, might have a thyroid imbalance, because the symptoms of congestive heart failure are very similar to the symptoms of low thyroid function, even though the thyroid hormones are normal. You start supplementing them with some thyroid medication and some herbs to kind of support it, and amino acids, and you find these people start coming around again. They start having energy, they have mental, you know, their mental clarity comes back, things like that. Okay, so what are the classic signs of myocardial infarction? Person gets pale, they get sweaty, they might get some pressure in the chest, they get nausea, some people get shooting pain radiating down the left side of the arm. Now there's another condition which is usually a precursor letting you know you've got a problem going on, and it's called angina or angina. Okay? This is a warning sign to you you've got a problem. And normally what happens with angina, you know, you've got a blockage going on. It's either an arterial spasm or you've got that plaque buildup, and you get a pain. And the pain usually is right in the heart, and it comes on with stress. Not just emotional, but physical stress. Okay? And that pain sometimes will go from the heart, it'll go up into your jaw. It'll also go down your arm. But you don't tend to have the other symptoms. Oh, am I boring you? I saw a yawn. Just picking on you. But anyway, with the angina attack, you know, you don't necessarily have all the symptoms of the heart attack. You know, with the cold clamminess, the sweating, the pain radiating down the arm. So you know that if you get angina, what do doctors normally prescribe for that? Nitroglycerin, right? Because it vasodilates. We can do the same thing with magnesium. We can do the same thing with L-carnitine. We can do the same thing with niacin. So there's ways to do it that I feel are better. Okay. Now we were talking about, you know, I'm not going to talk about, we already talked about this. I'll show it anyway. We talked about lipoprotein A being the biggest factor. Let's zoom out a little bit. Okay. Lipoprotein A is the greatest risk factor for cardiovascular disease known today. 10 times greater the risk when you have elevated lipoprotein. Well, that was A. We've got now lipoprotein B, and that's worse. The lipoprotein B, when you have an elevation of that, much worse than this. And we're using that as a more of a determinant today as to whether, you know, the severity of your condition. And we know that a person that has, let's say, an elevation of, well, let's say apolipoprotein B, elevation of another protein called D, and a decrease of ApoA, then you're at a much higher risk of having a heart attack. 8 times the risk of having a heart attack with that combination. Okay, so how do we treat this stuff? First, we have to diagnose it. There are certain tests that we run. We know about the standard ones that we run, which is this is actually arteriosclerosis activity evaluation, run by a particular lab in California. And they find that these are markers for inflammation in cardiovascular care. And remember I said earlier that I believe cardiovascular disease is an inflammatory process. You stop the inflammatory process, you detoxify the body, and you will see a reversal of these plaques. Okay? Now what we can do is we have to look at these molecules that create adhesion to the lining of the vessels. So they have found what they call intracellular adhesion molecule 1. Okay, and like it says, this protein mediates the adhesion and transmigration of leukocytes to the vascular endothelial wall. This step is thought to be critical in the initiation of arteriosclerosis or atherosclerosis. Okay, one studied a sample from male physician Harvard Health Study. They measured soluble ICAM-1 in the plasma of 474 males who developed a myocardial infarct and 474 controls who remained healthy. They found a significant association between increasing concentration of serum ICAM-1 and the risk of future myocardial infarction, particularly in subjects whose baseline level of serum ICAM-1 was in the upper quartile, greater than 260. Okay, I won't bore you with all the rest of that, but then we have the vascular cell adhesion molecule, and then what we call P-selectin, and then down here, C-reactive protein. C-reactive protein is an inflammatory protein. It gets elevated in the body when we have an inflammatory process going on. We have a certain amount of it going on normally anyway, but when we have a lot of inflammatory process going on, you see a marked elevation of C-reactive protein. And this has definitely shown increased risk. Now, how do we reverse heart disease? Okay. All right. 3 ways to reverse heart disease. Okay, 1, decreasing the deposits in coronary arteries. How do we do that? We have these supplements. Vitamin C, vitamin E, proline, and lysine. Proline and lysine help decreasing the stickiness and the adhesiveness of all these things. Helps break them up so they get carried back to the liver. Vitamin C and vitamin E. Vitamin E particularly an anti-inflammatory. Vitamin C also an anti-inflammatory. But the interesting thing is, I'll show you about vitamin C, is it's quite remarkable in lowering lipoprotein, particularly lipoprotein A. Oh, we're not done here yet. Okay, then you have to widen the coronary arteries. How do you do that again? Well, in this chart it says vitamin C and magnesium, but we also talked about niacin doing it. We talked about carnitine doing it. We have herbs that'll do it. We talk about hawthorn extracts. Ginkgo biloba opens peripheral circulation. So you can take these things, okay? And then 3, improving metabolism of the heart cell muscle. Carnitine, coenzyme 10, panathine, other B vitamins, magnesium, and other minerals. I'm a firm believer in trace minerals. Now there's, I'm sure a lot of you have already heard of, you know, the Great Salt Lake minerals or wherever they come from, you know, in Utah, and you know, the prehistoric seabeds that they mine up and everything. Well, I'm a firm believer in that. I do believe people are mineral deficient. We produce just about every vitamin in our body except for vitamin C. We do not produce minerals. The only way we get minerals in our body is by eating them. We don't eat enough minerals, we don't have enough. So, very important that we do supplement with minerals, because our food today is not nutrient rich in minerals. You have to remember, the plants consume what's in the soil. If the soil is deficient in selenium or iodine or other trace minerals, you're not going to get it either. That's why we have what we call goiter belts around the country, right? And around the world, in fact, because there's low iodine in those areas. People that eat predominantly the foods, eat predominantly the foods in those areas get goiters and get other, you know, problems as a result of it. Same with other trace minerals. We're finding out there's so much to know about all these other trace minerals, rubidium, gadolinium, you know, thorium, things like that, that we need those. We do need those. And the only way we get them is by consuming them. Coenzyme Q10, very interesting, is a pretty remarkable substance. The highest concentrations of coenzyme Q10 in our body are in our heart and our liver. And we only get that by consuming it as well, and through bacteria that are in our intestinal tract. And that's another problem. We have what we call dysbiosis. Dysbiosis is an imbalance of bacteria in our colon. We have too many pathogenic or bad bacteria, not enough favorable bacteria. So we have to do something about correcting that problem as well. How do we do that? Cultured foods, things like that. These are things that man ate typically in the past that, as a result of society today, we don't get them anymore. Therefore, we're seeing imbalances in our bodies. Okay, now we talked about vitamin C and its ability to lower lipoproteins. Okay, so we can see here, as this says, I'll raise it right here. Okay. At present, no prescription drugs is known to lower lipoprotein A blood levels or reduce the risk of cardiovascular disease from this tremendous risk factor. In contrast, 2 vitamins are known to decrease lipoprotein A blood levels. Vitamin C and vitamin B3 nicotinic acid, which is niacin, can decrease the production of lipoprotein A in the liver and thereby reduce the concentrations of these risk factors in the blood. So you can see how important vitamin C is in keeping us healthy. Like I say, it's also an anti-inflammatory vitamin. And if arteriosclerosis, atherosclerosis is a result of the inflammatory process, then we need to take it. We need to take more. But I'm going to also show you where taking certain herbals will do better than just the vitamins themselves. Okay, here's on nicotinic acid as well. This was a research study done in Stockholm, Sweden. Niacin was shown to lower the lipoprotein A blood levels. 4 grams of niacin decreased lipoprotein A blood levels by 38% over a period of 1 to 1.5 months. Okay, higher lipoprotein A blood level was at the beginning of the treatment. The greater was the effect the nicotinic acid in lowering the blood level risk factor. So the higher the level of the lipoprotein A, the lower it got over that 1 month period. Now again, how do we get some of these things out? I talked a little bit about chelation. Chelation therapy can be done in 2 ways. It can be done orally and it can be done intravenously. If you have a person that has a very serious arteriosclerotic process going on, I recommend the IV therapy along with the oral, because you've got to get something going quickly. And you're putting a high concentration of nutrient into the blood to get that process going to reverse it. Now, we see that, I don't have the statistics here, but they were showing about how many people get bypass surgery. That is something like an $85 billion a year industry. Bypass. Maybe I do have that here. No, I don't. Anyway, bypass surgery, $85 billion a year industry, and it does not necessarily work. They did some studies in Canada and the United States, and they found the 5-year survival rate of people having bypass was no different than the 5-year survival rate of people that didn't have any process, did not have the surgery. And it's risky. It's no good. So we use what we call EDTA, ethylene diamine tetranoic acetic acid. It's basically a cousin of vinegar, if you will. That's what it is, kind of, EDTA. And EDTA basically goes around and gobbles up calcium and heavy metals. It was used back in the 40s and 50s in the military to detoxify the soldiers when they got exposed to heavy metals, to get that stuff out of their blood. What we've done in medicine is just carried it on to do a better job. And as you can see here, it says EDTA is nearly 3.5 times less toxic than common aspirin and 300 times safer than bypass surgery. Chelation therapy has been used safely on more than 500,000 patients in the United States for the past 40 years without a single death attributed to the EDTA when the American College for Advancement of Medicine protocol is followed. They have a certain protocol with certain tests that you run to make sure that, you know, a person's not getting too much stress on their kidneys and such from getting all these calcium plaques and stuff going out of the system. So we have to monitor certain factors in the blood, and we regulate the dose of EDTA based on that. So here's how EDTA works. Okay. The main way chelation reverses our atherosclerosis is by removal of calcium plaque. Unabsorbed calcium floating in the bloodstream can build up in the tissues and joints and lead to the formation of plaque lesions on the inner walls of the arteries, making them thick and hardened, producing atherosclerosis. So the way we do it, break it up. Break it up with EDTA, vitamin C, and magnesium primarily. Those are the things we're using in the IV drips. Then, of course, you do the oral stuff. You do soluble fibers, you do amino acids, you do other vitamins, and you do herbs. Now, a lot of people say they don't believe you can reverse arteriosclerosis. Now, what I'm going to show you were some studies done, and these were angiograms done on individuals that did nothing but dietary modification, meaning they went on actually I shouldn't say dietary, they did lifestyle modification. That being, they started exercising every day. They did some kind of an aerobic exercise every day. They ate a low-fat, high-complex carbohydrate diet. And when I mean low-fat, I'm saying no more than 10% of their calories consumed came from fats. 10%. That's very low, because it's hard to get even a 30% diet in America of fat. That's what conventional medicine tries to put you on, just a 30% maximum fat diet. That's not enough, because a lot of people genetically can't produce enough of the HDLs to pull out those plaques at a 30% diet. So you have to go down to 10 to really make it work. So here is I guess I'll okay. Up top, you see a 40%, this is a 46% blockage of a blood vessel, basically, right in here, excuse me. 46% blockage. Now, in 12 months, this person was down to 36%, or 32% in 12 months, as a result of just changing the diet. 10% fat, high complex carbohydrates. Eating protein is very important, but getting the right kind of protein. I recommend vegetable source proteins like soy. Soy contains isoflavones, which help decrease plaques and HDL or LDL cholesterols in the system. So it's a very good substance. Now, another way of telling how well, this was a study done by Dr. Dean Ornish. Okay, and this is what we call positron emission tomography, PET scan. Okay, now when you look over here, this area here, that's poor circulation. There's virtually none. These levels where there's red, that's the highest level of circulation. This is the next highest level. The green is the next, and then the blue is the worst. Okay? Now you see, after they went on this low diet, this was 18 months. That's all they did. The dietary modification, 18 months. Look at the circulation here. Same person, same heart. That means the plaques, the arteriosclerotic process that was going on is clearing up. In fact, judging by that, it looks like it's gone. So that's pretty amazing when I look at it. Okay. Sure, go ahead.
Well, I read this book by supposedly ElectroMedicine, and he recommended chelation, but he said it would only work for the plaque with the densest amount of calcium, which would be the, I can't remember, but he said it wouldn't get it all out, it only get the densest calcium plaque out. What's your response to that?
I only partially agree with that. Because I have seen it take out even the not so dense calcium plaques.
So is that like
I think good point there as well. Anytime you do anything to any individual, as a practitioner, a healthcare practitioner, you absolutely have to take into consideration that individual person. Everybody responds differently to different things. And like I said earlier, you have to listen to your patient, listen to what the person's saying, because even though I have two people come in with the exact same symptoms, there is something about them that's different and unique, always. And you have to modify your program to those differences. You're going to give them similar things, but you're always going to make something a little bit different to make their process a little better. Very important. Yes? Oh, okay. Repeat the question. He was saying, first question was, he heard from an enlightened physician in a book, or read about it, that the chelation only works in the densest calcium deposits in the body. And I said, I only partially agree with that. And then you heard my response to that. Then he said, is it more specific to the individual patient? And I said, yes, because everybody is a little bit different. You have to modify the program based on that.
And I've also read before that thing where chelation didn't cause any death, but the automatic question in my mind is, well, what did it cause? Did it cause complications? What else could happen? I mean, I'm glad that we died, but what else happened?
Okay, you got to read into this one. We can't say chelation has never caused death, okay? But, oh, we took that down. What it did say, if they followed the protocol put out by ACAM, which is the group that teaches chelation, they have not had any deaths as a result of following that protocol. There have been deaths for people that tried to push the limit. That's why we monitor the blood every week, and we monitor, or we reduce or increase the amount of EDTA based on what the blood is telling us, because we know we're stressing the kidneys out, we're stressing the heart, you know. We know if it can take it or not. Okay? I get another sign? Cool.
So much for surreptitious.
Okay. Now, other factors that create, which I didn't get into, that create coronary heart disease is smoking, of course. And the reason being is that you're decreasing the oxygen in the blood. Cigarettes contain carbon monoxide. You hear that, Larry? Carbon monoxide. And when you smoke, you're decreasing the O2 and increasing O. And the reason being is that carbon monoxide binds to the blood more easily than carbon monoxide binds more to than oxygen. Thank you. I got lost. Okay. Again, we talked about being overweight. Also, because of nicotine in the cigarettes creates vasoconstriction. So you're actually adding to your problem. If you have intermittent claudication or TIAs and such, and you're smoking, you're actually making it worse by doing so. And it really hurts me, because when I see people like that, I had an individual, unfortunately he passed away, but I was asked to go take a look at this person. I went in there, he was on oxygen, he could hardly breathe, he couldn't walk from his bed to the bathroom, and they said, oh, can you do anything for him, Doc? And I asked him, I said, do you really want to get better? And he goes, yeah, I do, Doc. And he's smoking a cigarette. And he's on oxygen. He's on oxygen. And I just said, you know, I really want to help, but I don't think so, because a person that is on oxygen and they still smoke isn't really serious about telling me they want to get well. That person passed away about 3 weeks later. That you, Larry? Okay. Nice to know you're listening.
Everybody gets 6 months.
Okay, now over here what we have is, I have a formula that I made called HeartGuard, spelled G-U-A-R-D. And anyway, these are some of the ingredients in there. We've improved it based on our, what we know about it. I'll back it up a little bit. Oh, well. Okay, well, we have vitamin C in there. We have folic acid, vitamin B12, B6. The reason why we put those in there, we talked about homocysteine. We want to decrease homocysteine. The thing we found that decreases homocysteine the best is folic acid, B12, and B6. Very simple. And you don't need a lot. 400 micrograms of folic acid and B12. That's all. 400 micrograms. That's nothing. And you can bring the levels down significantly. You put them up to 800 micrograms and you've really done a good thing. We have, again, vitamin C for decreasing the clotting factors in the blood, decreasing inflammatory process. We have CoQ10 in there. In CoQ10, like I say, the highest concentration of CoQ10 in the body is in the heart. Interestingly enough, as we get older, we've got less of it. So it's important that we supplement with CoQ10. And what that does is it keeps the heart strong, the contractility of the heart strong, keeps the muscle fibers flexible. We have citrus pectin, and the thing about citrus pectin is it's a soluble fiber. It gets absorbed in the system and it takes the fat out. Anything to help with that. We have crataegus, common name hawthornberry. Hawthornberry extract has been found to be an exceptional cardiotonic. I have some research articles here I could show you on that. And it's likened to digitalis. Digitalis is something we prescribe to individuals that have a weak heart contractility. It's not pumping strong, so we give them digitalis. Well, we can give them hawthornberry, and it doesn't have the toxicity of digitalis. Because when you're giving a person digitalis, you've got to do what we call digoxin levels in their blood and make sure they're not getting toxic from it. You don't have to worry about that with hawthornberry. And in naturopathic medicine, we talk about hawthornberry being an exclusive tonic to the cardiac muscle fibers specific. So very, very good substance to have. And the reason it does that is it has flavonoids in it. Joseph, you had a question? Vitamin C? Well, we have a blend of vitamin C. We have the buffered C, magnesium ascorbate and such, and just straight ascorbic acid. Straight ascorbic acid works just as good. The only reason you might want to go with a buffered C is if a person is very sensitive to vitamin C. But they need to take roughly 3 grams a day of vitamin C to get the benefit. And some people have sensitive stomachs and it creates diarrhea. So you use a buffered C, magnesium ascorbate preferably because you're trying to reduce calcium, right? Magnesium ascorbate will get rid of the irritation in the gut and also gives you a little bit of magnesium, which helps the process. Yes?
How is garlic? Is that beneficial to the heart?
Garlic absolutely has been beneficial to the heart as well. The thing about garlic is the allicin in it, and the allicin and alanine or allerene is used for decreasing the plaques. That's the benefit of that. Yes?
I kind of look at nutrition like the stock market. I don't have a whole lot of time to keep up with it.
That's right.
And being a layperson, you're throwing a bunch of big words at us, and I know you know a lot, but for a guy like myself, who do I go see to find out what my diet should be?
Okay, he's asking the question that he doesn't have enough time as a layperson to keep up with the latest and greatest in nutrition. Myself as a physician in the industry, it's very hard because there's so much research coming out on so many different levels every day. It's kind of like being I come from Seattle, that's where all the computer geeks are, and computer industry is growing so fast. I have friends that are PhDs that can't keep up with it. And I'm actually the same with the nutrition. I have literally stacks of magazines that come every week like this, and I can't get through all of them. But I have to just try to peruse, and then when I see something that really catches my eye, I go, and then I try to read it and try to remember what I see. Where do you live? He also asked where can he go to get, this nutritional...
I live in Golden, but I'm basically from Oklahoma.
Oh, okay.
But in a more generic sense,
Okay.
where would people go, who would they go see to get a prescription?
I would recommend trying to find a holistic medical doctor in your area or find someone who is a naturopathic physician. or licensed nutritionist. That now, when I say licensed nutritionist, you have to understand they're just like doctors. There are two types of nutritionists. You have what I call the holistic nutritionist and conventional nutritionist. You don't want to go to the conventional nutritionist because that's going to be like going to a conventional doctor and asking him, is this herb good for this? And he'll go, that's quackery. That's garbage. Don't even mess with it. You hear it all the time. And, I have people, because I do have a supplement company, people will call our company and try to order supplements, and they'll say, well, I want to send this to my doctor first, particularly regarding an herb. And not to knock most conventional doctors, but you go and send him something about curcuma, he doesn't even know what it is. How is he going to be able to give you a fair assessment about it if he doesn't understand it? Not that they don't want to know, but like you, it takes time to learn. So they can't make a snap judgment. And most of them don't want to. They're making money and they're happy. It's business. Medicine is business, folks, and a lot of doctors treat it just as that. They want to help people, but they want to do it with the least amount of work and effort. But I call myself Dr. Waling because the word doctor means teacher. I'm also a physician. Physician is a healer. But I'm a doctor first and foremost. I believe in educating my people so that they can make decisions and try to do things for themselves, because self-help is really what it's all about. All I can do is give you the tools to do the job. It's up to you to do it. But the more information I give you, the better you can do the job. The better you have a chance of getting better. Joseph.
Wouldn't you safely say that any male over 40 would not hurt himself by taking your health card product?
I would safely say that that's a good bet. I take it every day myself. I try to practice what I preach. Yes, sir.
Which one of these herbs and vitamins are best for high blood pressure? How do you grab for high blood pressure?
Which one of the herbs are best for high blood pressure? Well, you want to go with things that are vasodilated, that open up the arteries, okay? Now, when we're talking the herbs, ginkgo biloba is very good for that. Again, hawthorn berry will do that too. It dilates arteries and peripheral circulation. The other thing, you want to take enzymes. Bromelain helps to break those plaques up as well. That's also in the heart guard. Yes. Viscum album. Never heard of it. Yes, I have. Just kidding. Okay, yes. Viscum is also another herb that's very good with opening up the... Viscum is mistletoe. Thank you. Common name. And mistletoe has been used traditionally in Europe for arterial disease, and it works quite well. Yes, sir.
Any double-blind studies been done to prove the efficacy of the heart drug?
No. But there have been double-blind studies done on the ingredients in HeartGuard. Okay? And you'll notice that my company does not produce single remedy products. Single remedy meaning straight vitamin C, straight ginkgo biloba. I'm a firm believer in synergy. Just like the universe, everything is synergistic. Everything works together, comes into play. And it's not just one thing that does it all. So I try to put blends together that I believe are good based on partly my clinical experience and partly on what the literature has to tell me from the people that have done the studies. But based on, unfortunately, the way people are today, I might have to start supplying individual type things because some people still haven't caught on to the concept of synergy and combination therapy. Yes, sir, you had a question?
How about
Cayenne pepper. Cayenne pepper is also a vasodilatory herb, and it also helps decreases the stickiness of the platelets, which create clots. So cayenne's very good, and it can clean out over a period of time arteriosclerotic plaques. That's an old Dr. John Christopher remedy that goes way back, and wonderful. He used to sit there and promote drinking that stuff by the tablespoons. That's rough, boy. I tell you, I've tried it.
I think the insurance companies look at chelation and some of these things.
Interesting question. Several doctors have gone to the insurance industry to talk about how if the insurance companies would get behind something like chelation therapy and dietary modification, they would save the insurance companies money. The insurance companies, like I say, they're spending, like $100,000 to $300,000 for bypass surgeries on people. Now, what they have found is that Mutual of Omaha, I think it was Mutual of Omaha, agreed to get behind the chelation group and the dietary modification group, and they found that they actually saved $30,000 to $40,000 per patient by not supporting the bypass and by going with the holistic approach. They saved money. They didn't lose money. Yes, sir.
Well, about 6 years, 7 years back, I had gone to the doctor and they did a complete, what's called a vascular analysis, doing the Doppler and all that. And they prescribed chelation for me for my legs, for my peripheral vascular disorder that I have. And they gave me chelation, and surprisingly, I have Cigna insurance. So, you might consider Cigna, but because of the reports, they've been paying for mine.
Yeah, that's right. Cigna is, well, there's several companies now that are getting behind this. Mutual of Omaha was the first, and Cigna, yes, is one. And I wish I could tell you, I have a list of companies that do support chelation therapy, but if you call the insurance commissioner or whatever, I think they could tell you who in your area will get behind it. This is why, unfortunately, I'm not pro HMO either. HMOs have a way of trying to save money, but they don't try to save it the right way. They try to save it the wrong way. Yes?
As far as trying to find a homeopathic physician in the area, most health food stores would want you.
That's true. He's saying that if you want to find a naturopathic or homeopathic physician, health food stores tend to know those individuals as well. They are a very good source for information like that. Now, I'll try to cover, I don't know, I have all these studies showing ginkgo biloba being beneficial in heart disease and all that. Do you want to see that, or we just want to keep going with questions? Because, anybody can see these. Oh, well, there's some things that I want to talk about, like quercetin and curcuma. Curcuma and green tea. Green tea contains what they call catechins, and these catechins and polyphenols have been known to decrease inflammatory process again. And when you're decreasing the inflammatory hormones and such, you're decreasing arteriosclerotic plaques. So they found that if you take, let's say, 8 cups of green tea a day, strong brewed, you actually start reversing the process. That's very simple, isn't it, folks? Very simple thing to do. 8 cups of green tea a day. Yes, Walter?
Can you put cream in your green tea? Or
Well, I wouldn't recommend it. You can, but, that's like saying, I got this headache, Doc, and you're hitting it with a hammer. How come it won't stop? Yeah.
Will that give you diarrhea?
Green tea? I don't think so. Like they say, 1 billion Chinese can't be all Wong. Attitude plays a very important part. They found that people that maintain a positive attitude in life have much more success in defeating their condition of heart disease or vascular disorders. Plus, they found people that are in support groups, church groups, prayer groups, whatever, also tend to get over their conditions and be longer lived than people that tend to stay on their own. In fact, 30% more people, there's a 30% more mortality rate in people that don't get around a support group and have a positive attitude. They need it. People need other people to give them energy. It's all energy, folks. It's all energy. Even when I give you these things, we can talk about bioflavonoids and phenols and catechins and all that. But the thing is that's important is it's energy, it's vibration, it's frequency. And what we're doing, anytime you have a condition in the body, that's gone awry, what you have to do is retune it. And all these things are mechanisms for tuning that vibration back up, to get it back to the frequency that it was, to correct the problem. No disease state starts in the body unless you have an imbalance in the frequency. Pure and simple.
Do you know any doctors that diagnose by frequency meters?
Yes, there are several of them around. There are several in beg your pardon?
What kind of a device is it?
Boy, that's numerous. Everybody has their own little way of doing it. There was one that was called the occlusion device. They were out of Denver, but they're no longer in business, unfortunately. But it was the most remarkable device I had seen at the time. Very accurate, very good. But even to find one today is rare. I'd love to find another one around. Yes.
Based on your knowledge, kind of a general question, would you say that because medicine is such a big business, would it be correct to say that there is a quote-unquote conspiracy to keep medicine big business, keep health?
Okay, his question was that medicine is big business and the industry is trying to keep medicine a big business, therefore we're not going to see the cures for things. There is truth in that. However, if you start looking in the stores now, you're starting to see one a day coming out with herbal formulas and such. See, they're now catching the wave because, see, the herbal industry and the nutritional industry is getting big. Now it's in the billions of dollars. You're talking like $14 billion a year now in supplement industry alone. And if you include weight loss and some of these other things, you're talking $80 billion, you know? So now it's getting big enough for the pharmaceutical companies to get involved. But see, they let the little guys like myself, you know, scrape our knuckles and prove it out first because they didn't want to spend their dollars. They were making money with the drugs and the other stuff. They didn't want to mess with it. So they let everybody else prove it out. Now that it's catching on, they're trying to gobble up the industry because they have the bucks to go in and market. And their products are good, I have to admit it. They're coming out with good quality products, pharmaceutical grade, you know, which makes it hard for smaller people that don't have the technology or the means to do that quality of work. Not that they don't want to, but it's very expensive to get started in it if you're not already in it.
So it really is just whatever the dollar is.
It's dollar motivated, you know. That's right. Dollar motivated, profit motivated. See, with our company, we're trying to get, I go to stores or have my rep go to the stores and say, what is it that people are asking for? What do you want for a product? And they're saying, well, we just sell whatever's popular. And it's because a lot of the stores aren't educated either. They don't know anything about this stuff. It's there because they're selling it, pure and simple. And whatever is the craze is what they want. We're now in the process of trying to change that. Like I said, I use the word doctor very seriously. I want to teach. So we're now trying to teach these buyers in the stores, well, yeah, you know, we can give you that St. John's wort, but wouldn't you rather have this because we can do more? And if we educate your pharmacists or whatever, that makes it better, doesn't it? You're giving a better service to your customer and giving them a better product. And they like that. But see, no one's ever taken that approach because it's expensive to do and time consuming.
Can you say something about natural versus synthetic vitamins?
Sure, natural versus synthetic. Natural's the only way to go. Synthetic vitamins might molecularly be there, but again, frequency, vibration. They've proven it with vitamin E. They use synthetic vitamin E versus natural vitamin E, and natural vitamin E killed it in its ability to, you know, do the things that it was supposed to do, you know, as an antioxidant and such. Yes, sir.
Could it also be the fact that they're using something that has life energy in it versus?
Exactly. When I speak of frequency, that's exactly what I mean. There is a life energy. You know, we've all seen Kirlian photography. You take, and I've seen these too, Kirlian photography of a synthetic vitamin, Kirlian photography of a natural vitamin, no comparison. It's there. Or the way it's processed. Now, see, one of the things I haven't gotten into You know, we talked about diet, but other things we can do to reverse arteriosclerosis, good water, structured water, living water. Believe it or not, high doses of this water consumed on a daily basis will in fact reduce these plaques in time. You need water to metabolize fat. People don't think about that. That could be your best medicine. Having a nice structured water. Very important.
Define structured water.
Structured water. Well, no, it's way beyond ionized. You know, you have a certain molecular structure and cluster form of water, and when you can get water to a certain structure or cluster size, let's say, it penetrates into the cells better. It pulls toxins out better. It has antioxidant properties. It does everything. And then you can oxygenate the water like Joseph has, an oxygenated water, because we also need oxygen in our bodies. And we are deficient in oxygen today, folks, because we have less oxygen in our environment. So we need to get more oxygen in our system. And so using the structured water with oxygen in it is a great medium for getting more of what you need in your body to do what nature originally had. You know, when you got the original deep waters that are 15,000 years old, those are clean, pristine, and full of life. And we can recreate that now. We can recreate that. We have the technology to do so. Beg your pardon?
Floor. The guy called Floor in Germany.
Oh, Plor, yeah.
Pinac cat.
That's right.
Buy one. You have structured water.
Larry.
Is wine and cheese bad for you at 9 o'clock?
Oh, no, you know, it's 9 o'clock, and, you know, that would be just a great way to end, you know, this conference, you know, with a wine and cheese party. But before we all go, I have one little thing I wanted to share with everybody. Where do we get it? Well, there's a gentleman sitting right here. He's going to talk about it. There's several companies now that are starting to sell structured water in America.
Ron, another point, you never brought it up, and I think it's very important. Margarine.
Oh, trans fatty acids. Thank you. Totally bad. I don't know how I forgot that because it was in my notes. I just skipped over it.
And I was afraid you weren't going to talk.
Now, the thing about trans fatty acids are unnatural fats. What it is you got a liquid oil, okay, like canola oil or whatever, that at room temperature is soft. It's liquid. What they do is they bubble hydrogen gas into it, and that hardens it. So it stays firm at room temperature. If you take butter and put it next to margarine at room temperature, butter will start to melt. Margarine will not. And when you put it in your body, it does the same thing. And those trans fatty acids compete on binding sites where good cholesterol should be. The trans fatty acids go, and it creates an imbalance there. Also, with a person that has like multiple sclerosis, there's a problem with that. Because see, the myelin sheath, which is the insulation around the nerve, uses what we call cis fatty acids. That's the natural stuff. The trans fatty acid is more competitive to the site than the cis fatty acid, and it gets in there into the myelin sheath and creates a poor quality myelin sheath, which doesn't give you the insulative factor that you need for a healthy nerve cell. When you have someone with multiple sclerosis, margarine, hydrogenated oils, absolutely deadly for anybody. Now companies are starting to come out with low trans fatty acid or no fatty acid margarines, and the non-hydrogenated, in other words. And you know, there's a simple thing that you can do to make your own. It does contain a little butter, but not bad. It's what we call better butter. And all you do is you take real butter and you pour some olive oil or canola or whatever in it and blend it. And then that makes it soft and spreadable, and you have no trans fatty acids whatsoever. And you get a good blend that will be good for you.
I have to say one thing. Did you ever read a book called Chlorine, Cholesterol, and Coronary?
Oh, I haven't read the book, but I'm familiar with it.
Well, the guy said that chlorine gas, after World War I, there was so much of it that the munitions makers weren't going to lose money on it. So they came up with a scam and they put it in water.
Water. Well, same thing with fluoride.
The industry began to use that water to wash their stainless steel.
That's right.
The greasy substance was deposited on the stainless steel, i.e. cholesterol, which is in everybody's
Right.
And the presence of chlorine causes a greasy substance.
That's right. The buildup of plaques.
And we can talk about all the herbs and all that, but if you continue to drink
That's right.
water, you're going to have
Clean water, very important. One other thing I want to talk about was magnetics. You drink North Pole magnetic water because we talked about inflammatory process. There is nothing that works as, to me, that is wonderful stuff. You magnetically energize your water with a North Pole magnet, and you will see that water do some amazing things for healing inflammations. It's healed degenerative disorders, nothing but lots of water, North Pole magnetized. There's even been some work done showing that North Polar water slows down the aging process of the cell.
And what we need to know is that the north-seeking pole,
North-seeking pole, correct.
which is really the south pole.
Well, no, go ahead, Walter. I'll let you answer this. Speak up loud.
When I first started working on this 30 years ago, I was a heavy drinking guy. And I used to go out in the bars in Barcelona and really drink, and go back to my hotel suite and have 2 glasses of North Pole water and go out, sober up, and go out and drink again. It'll sober you up, too.
Yeah, North Pole water.
I don't do that anymore, by the way.
Well, you want to talk about the north-seeking pole real quick? Okay, well, he's going to cover this anyway. So catch Walter's lecture on magnetism because that's his field. Also, now I just wanted to show this one little thing that I think is very important to say, put out by James Allen, and it's called As You Think, You Travel. As you think, you travel, and as you love, you attract. You are today where your thoughts brought you. You cannot escape the results of your thoughts. But you can endure, accept, and be glad. You will realize the vision, not the idle wish of your heart, be it base or beautiful or a mixture of both. For you will always gravitate toward that which you secretly love. Into your hands will be placed the exact results of your thoughts. You will receive that which you earned, no more, no less. Whatever your present environment may be, you will fall, remain, or rise with your thoughts, your visions, your ideals. You will become as big as your dominant aspirations. And with that, I thank you, and have a good evening. No, a lot of people want me to write one. I just haven't gotten to it.
sell this tape they're making.
Yeah, I think I will. I need to get one of them round to it. Out of